I love that. Hey, welcome back to Indy Now. We have been talking about this month, it's Breast Cancer Awareness Month, and Dr. Emily Klein is here from our sponsor, Johnson Memorial Health. And you might have heard us laughing because she always makes us laugh. That's what I love. She's such an approachable doctor. Thank you so much for being here with us.
I'm happy to be here again. It's a lot of fun.
Yeah, we're talking about a really important topic, and throughout the month we talk about this. So let's just dive right in. What are the symptoms? Because I think that all myself. What do I need to be looking for?
Yeah, so we definitely want to save those tatas. So
this is what I'm talking about.
And there may not necessarily be any symptoms, and
Yes.
that's the thing. So with screening, what we're trying to do is find illness early
Yes.
in someone who's asymptomatic, right?
Right.
But if you do have symptoms, it's important to contact your doctor. So things like nipple discharge, any breast pain, redness of the skin or any other skin changes, and certainly if you find a lump.
Right.
We don't really advocate self-breast exam anymore, but what we really want people to do is just be aware of their own breasts.
Yeah.
Because then if you're aware of what your breasts are normally, if you notice a change, then you can contact your doctor and maybe find something early. But screening is even before that.
Well, that's really good advice, because I think in general, when you're comfortable with your body and you know your body, that's when you're more in tune with like something's not right, and I'm sure you get that all the time. Someone comes in, they're like, just something doesn't seem right.
Right, and women should trust their intuition and trust their bodies. I'm a firm believer in the fact that women kind of know what's going on, and if someone keeps telling me, no, there's something wrong, I keep digging, right? Because you don't want to just dismiss that person, dismiss that complaint, and then potentially miss something. So it's always okay to call, always okay to ask the question.
You hear that story all the time where someone's like, I knew something was up, but they just had to keep pushing.
Well, 50 to 70% of breast cancers are found by women themselves, and not necessarily by a screening exam. So it's really important to honor that.
That's a pretty staggering number. I didn't realize that.
Yeah.
And that's why it's so important for anybody watching right now. If I'm sitting at home and I'm thinking, well, I don't have any symptoms, should I just assume I'm cancer-free? What do you say to people who ask that question?
Yeah, so we never want to assume. But we want to keep risk low. So in the average risk person, so in somebody who doesn't have a strong family history, who has never had radiation to their chest area, doesn't have history of other cancers in the family that could be genetically linked, if you're average risk, then you can assume that you're probably cancer-free. But 1 in 8 women will develop cancer in their lifetime. Wow. So 12%. So you look around a room, if there's 10 women in the room, somebody has cancer, right?
That is just really sinks in.
And maybe we just haven't found it yet. So if you don't screen, you don't find it early, and then it's harder to treat, and then the prognosis is worse.
Yeah, early screening is what it's all about.
Early screening.
We do want to talk about the HERB program, because I know you were telling us a little bit about that last time, and that's a really great program for all our ladies to know about here.
Yeah, so this is a program that is designed to be open access to women. We want women to be able to call, get in, get problems addressed. Don't necessarily need a referral from your physician. Certainly you can have one if you want.
Sure.
And currently we're focusing mostly on urinary incontinence and pelvic organ prolapse, but we want to be there for all of women's health care, be able to get them in touch with the services and the resources that they need.
Yeah, and the reason I always talk about how much I love your sense of humor is because it can be hard to, schedule that appointment. You dread it sometimes, and then if you have a doctor that you feel comfortable with, makes you laugh, that always helps. So if anybody's watching and they'd like to come see you, what do they need to know?
Well, easy to contact us through our website or email, which is forher@johnsonmemorial.org, or our phone number, which is 833-383-4her.
Oh, see, and we got that right there on the screen. That is perfect.
Yeah.
Thank you so much for coming in, as always, and giving us
a
chuckle as you do. You're the best. Thank you.
Thank you. You have a great day.
All right, we'll still have